Hi everyone, Eileen Veilleux The Fam here. Welcome to the first installment in Narcolepsy, in our mini mental health series. And in this installment, we are going to do an overview of it, which will be covering the symptoms, causes, complications, and risk factors of narcolepsy. Before we begin, just a gentle reminder that throughout the video there will be 3 key words. So watch the full video. After you watch the full video, in the comment section, please, with a genuine comment, put down the 3 key words in the video. That would be greatly appreciated. This way you can be entered into a free merch giveaway when I reach 2,000 subscribers. So saying that, let's get started with this. Narcolepsy is a chronic sleep disorder. That's the key word. Key word again, sleep disorder. Characterized by overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy often find it difficult to stay awake for long periods of time, regardless of the circumstances. Narcolepsy can cause serious disruptions in your daily routine. Sometimes narcolepsy can be accompanied by a sudden loss of muscle tone, which can be triggered by strong emotion. Narcolepsy that occurs with loss of muscle tone is called type 1 narcolepsy. Narcolepsy that occurs without loss of muscle tone is known as type 2 narcolepsy. Narcolepsy is a chronic condition for which there is no cure. However, medications and lifestyle changes can help you manage the symptoms. Support from others like family, friends, employees, teachers can also help you cope with narcolepsy. The signs and symptoms of narcolepsy may worsen for the first few years and then continue for life. They include excessive daytime sleepiness. People with narcolepsy fall asleep without warning, anywhere, anytime. For example, you may be working or talking with friends and suddenly you nod off, sleeping for a few minutes up to a half hour. When you're waking, you feel refreshed, but eventually you get sleepy again. You may also experience decreased alertness and focus throughout the day. Excessive daytime sleepiness usually is the first symptom to appear and is often the most troublesome, making it difficult for you to concentrate and fully function. Sudden loss of muscle tone. This condition, called Cataplexy, can cause a number of physical changes, from slurred speech to complete weakness of most muscles, and may last up to a few minutes. Cataplexy is uncontrollable and is triggered by intense emotions, usually positive ones such as laughter or excitement, but sometimes fear, surprise, or anger. For example, when you laugh, your head may drop uncontrollably or your knees may suddenly buckle. Some people with narcolepsy experience 1 or 2 episodes of cataplexy a year, while others have numerous episodes daily. Not everyone with narcolepsy experiences cataplexy. Sleep paralysis. People with narcolepsy often experience a temporary inability to move or speak while falling asleep or upon waking. These episodes are usually brief, lasting a few seconds or minutes, but can be frightening. You may be aware of the condition and have difficulty recalling it afterward, even if you had no control over what was happening to you. The sleep paralysis mimics the type of temporary paralysis that normally occurs during a period of sleep called rapid eye movement, or REM sleep. This temporary immobility during REM sleep may prevent your body from acting out dream activity. Not everyone with sleep paralysis has narcolepsy. However, many people without narcolepsy experience some episodes of sleep paralysis. Changes in REM sleep. REM sleep is typically when most dreaming happens. REM sleep can occur at any time of the day in people with narcolepsy. People with narcolepsy often transition quickly to REM sleep, usually within 15 minutes of falling asleep. Hallucinations. These hallucinations are called hypnagogic hallucinations. If they happen as you fall asleep, and hypnopompic hallucinations is if they occur upon wakening. An example is falling asleep as if there is a stranger in your bedroom. These hallucinations may be particularly vivid and frightening because you may not be fully asleep when you begin dreaming and you experience your dreams as reality. Other characteristics of narcolepsy. People with narcolepsy may have other sleep disorders, such as keyword obstructive sleep apnea, a condition in which breathing starts and stops throughout the night, restless leg syndrome, and even insomnia. Some people with narcolepsy experience automatic behavior during brief episodes of narcolepsy. For example, you may fall asleep while performing a task you normally perform, such as writing, typing, or driving, and you continue to perform that task while asleep. When you awaken, you can't remember what you did, and you probably didn't do it well. The causes of narcolepsy is unknown. People with type 1 narcolepsy have low levels of the chemical hyposphinchin, which is an important neurochemical in your brain that helps regulate wakefulness and REM sleep. Hypocretin levels are particularly low in those who experience cataplexy. Exactly what causes the loss of hypocretin producing cells in the brain isn't known, but experts suspect it's due to autoimmune reaction. It is also likely that genetics play a role in the development of narcolepsy, but the risk of a patient passing this disorder to a child is very low, about 1%. Research also